We hope that today will actually lead to better dialogue. Sometimes a health debate and policy debates around health are focused on the negative or the bits where people disagree, when in actual fact we know that there are plenty of areas where we do agree, and we want to bring those to the surface to give government the support they need to be brave when they think about reforming our health system.
Well, this is really exciting. What APNA is doing is bringing together people to talk about how to reform our primary healthcare system in Australia and looking at innovative ways, particularly to make sure that strong primary healthcare services are available to everybody, no matter who you are, no matter where you live, and that healthcare professionals can work together to deliver even better quality care to the people of our nation.
It's really important when governments are considering reforms. They need to know that the experts are in alignment and they don't have to deal with sorting out disputes between one part of the sector and another. So having that strong, uniform voice with consensus about what needs to be done makes the job of decision making for governments just that much easier.
So we've got in the room here a range of health leaders across allied health, across nursing, across medical and government. And what they're doing is looking at the major reform issues that we have in the primary healthcare environment. And they're actually collaborating to come up with some systems level reforms to address those aims. So we've got them working in cross-functional teams, and later in the afternoon we're going to get them to do some pitching of what they've come up with and try to get support of other tables around the room. So a real collaborative opportunity to come together to address some of the major issues in the primary healthcare environment.
So there's loading your first box, but you've just had a 10-minute warning.
Yes,
and hopefully
we're
you
writing
sit down with Dr. Anthony after you.
I think it's been a really, really interesting day with just getting a whole group of very interested professionals together to talk through the problems and what we can see to try and help resolve them.
It's the first time in 20 years that this has happened at this scale, so hopefully it's the first of many, and hopefully we can get enough traction within the system to actually have the decision makers make some change.
We're here to be making a difference. First point of contact, that's really what all the primary care is all about.
Government has in its possession, or soon to be in its possession, a whole variety of reform documents. Based on today's inputs, those reforms have been endorsed by this group, so let's just get on and enact them in the next budget.
It feels amazing to have this many health leaders getting along and having a great time, actually looking at the challenges that we see in the health system, but also where they agree. We couldn't have hoped for a better outcome today, and you can hear behind me right now, they're still here talking, and it's half an hour after it finished. It's a great sign that there is more collaboration and more consensus to be had in primary healthcare.